I grew up in a town of 3,000 people, and my family had a small farm that we were kind of like subsistence farmers, and so I had chores that I had to do and whatnot, but it was a normal childhood, and I grew up skateboarding and snowboarding and did that a lot. When I say a farm, I'm talking just a couple acres. The people out here they're rocking hundreds and thousands of acres. So, you know, if I say farm too loud around some of those people, they're going to be like, well, how many head do you have? And I'd say 4. You know, we kind of raised our own meat and had a pretty awesome garden, things like that. So my parents really kind of dig that kind of thing. I just recently finished my trauma fellowship, which is an extra year of training after residency in Sacramento, California. I grew up in New York, upstate New York, and then moved to Bozeman, Montana, where I did my undergrad and a little extra time because I love to snowboard. And then I moved down to Phoenix to do my medical school, Tulsa, Oklahoma for residency. Then I did a couple of jaunts in other places like Tampa, Florida, and Cincinnati to get some further training. But now I'm here, and we love it. We like doing outdoor activities, and we've been up to Big Sky a number of times already this year. But that's really what initially pulled me out to Montana from New York was snowboarding. I wanted to go to a school that was close to a mountain and still get kind of the best of both worlds. And then, you know, like anybody, you live out here for a little while and you realize how awesome it is. I always knew that I was going to come back to Montana to practice. And throughout all of my training, I always knew this is where I wanted to be. I enjoyed the sciences during undergrad, and I excelled in them. And of all the different studies, I found that they were, you know, the ones that my chemistry classes, physics classes, and actually anatomy, when I just really enjoyed it. And so that made me realize that medicine would be a good fit. And then, you know, a couple extra careless moves up at Bridger Bowl has landed me with some surgical procedures on myself. And so that exposed me to orthopedic surgery, you know, during undergrad, and that made me, you know, that piqued my interest in it and kind of cemented the fact that I wanted to become a physician, and also my interest in orthopedics. I've had a couple different accidents from snowboarding and other activities, and I've had to have some things like an ACL done and ankle surgery, and you know, just the whole process. You know, you go in, you're injured as a patient, you don't really know what's happening. It's not like I was planning on hurting myself, but it happened. So you show up at the hospital and they refer you to an orthopod. The guy that I got referred to in Bozeman, he's still practicing. He's a good guy, and he did a really good job on me and kind of led me through and told me what to expect, helped me out with the rehab, and really got me back on my feet. And that was a big moment. You know, that was a big deal, and that's kind of the same thing that I think about now as I'm talking to patients and trying to get them past this point, you know, get them back to as whole as they can be. And so I think about the experiences that I've gone through and try to project them, I guess, to help my patients. I think I can empathize with patients because I've been through it. Patients have had some catastrophic thing happen to them, and they're thrust into this situation that nobody wants to be in, which makes orthopedic trauma a different beast than other kinds of orthopedic medicine. And so I kind of try to, you know, I try to make that as easy as a situation, and I try to, you know, help my patients. I can't undo the injury that's been done to them, but I can take the pieces that are left over and make them as whole as possible. I had a patient when I first came here. She was a 15-year-old girl who got hit by a fully loaded beat truck that she unfortunately separated her pelvis on both sides from her spine, and required a very long, extensive surgery, about a 10-hour-long surgery. We got her all put back together, and she's going to be able to play tennis this year. So she's up and walking and doing very well. That'd be That'd be one example of many that we've seen here. Nobody ever plans on getting hurt, you know? Nobody ever anticipates that they're going to have this horrible accident. So when they come into the hospital for that, it's a totally different mindset and different ball game than somebody who's planning to have their knee replaced. They know ahead of time that they're going to be coming in for this surgery, and they already kind of know what to expect and everything. That patient is totally different than a trauma patient, and I think that a good trauma surgeon and a good trauma practice needs to accept that uncertainty and kind of help lead the patients through it.